መጀመሪያ ራሴን ሳቅም ያንንም ቀን መሞት ነገር ነበር ይመስለኝ መኖር ብቻ እችላለሁ አልኳት ሌላ አሁን ምንም መኖር እችላለሁ እንደሶስ ትኖሪያለሽ አለች ቢያንስ ወደ 10 አመት በቃ HIV ጋር መኖር ከጀመረ
Currently people look at HIV as a preventable disease. As a result they have low stigma and discrimination.
አሁን ያ ጨለማሉ ጠፋ
Since the first HIV/AIDS, cases have been reported in the 1980s in Ethiopia. Hundreds, thousands of people have died, and tens of thousands of children have been left without parents and become orphaned, and those who are still living them found themselves in hopelessness and despair. The scare the epidemic had left on the overall development of the country was also enormous. As was usual among most of the victims, Gannet was not aware of her HIV status. She learned about her case after her husband's mysterious illness. Out of curiosity and suspicion, she went to a nearby health center and got tested. The result was a source of hopelessness for years to come. A deep sense of despair overwhelmed her.
ባለቤቴ ወታደር ነበረ ከዛን አልነገረኝም እሱ ግን መድኃኒት እየወሰደ ነበር እኔ መድኃኒቱ ምን መሆኑን ራሱ አላውቀው እና ግን ራሴ ነበር የምሰጠው ራሴ በምሰጠው ሰዓት ሰው ጋር ነበር የምሰጠው በ96 97 አካባቢ ማለት ነው የማውቀው ነገር የለኝም ግን እዛው ስለሌለኝ ስለማላውቀው ማለት ነው
Because of the lack of awareness among the majority of the population, the epidemic was considered as an unpreventable disease. Rather, it was viewed as an epidemic that had occurred as a wrath of God or some other cause. As a result, the popular perception about HIV/AIDS was heavily loaded with high stigma and discrimination.
ይሄ ራሳ ታገልልኛለች አቆ ከሆነ እኔ ምንም እውነት ይሄዳለች እሷ ታቃለች ከተሞሽ ታገልልኛለች
Because of the lack of awareness and absence of a comprehensive HIV/AIDS care and treatment services, such discrimination and stigmatization was imminent. People saw their families, relatives, friends or acquaintances fall sick, become bedridden, and eventually die. For them, being infected with HIV/AIDS was an immediate death warrant. Very few then could afford antiretroviral treatment, ART. Even those who could afford it couldn't sustain it for long since it was very expensive.
People who were sick used to go to Uganda for treatment, to Kenya. They used to sell their cars, their houses to get treatment, and they used to hide behind. They never made it public, they were hidden. It was done all underground. So we were in a very desperate situation.
The impact of the epidemic was enormous, and thus affected the nation's potential for development so much that it drained the country's meager resources, particularly in the health sector.
Around 40-50% of the beds were occupied by people with HIV/AIDS, and as a result, other diseases were crowded out. Meaning, other diseases, health problems like malaria, tuberculosis, and other even maternal health problems were not well addressed because the beds were already occupied by people living with HIV/AIDS.
In the year 2005, the situation was dramatically changed when the government of Ethiopia launched a rapid expansion of comprehensive free HIV/AIDS services at a national level. This policy orientation was aimed at scaling up the HIV/AIDS services to the most vulnerable by transferring the prime responsibility of HIV patient care from physicians in hospitals to middle-level health workers in health centers.
The vision was to provide free HIV/AIDS services, to make sure that people who need the service get it as easily as possible.
We cannot treat HIV in the hospitals only, by doctors only. We have to treat at the health center. We cannot treat them in the urban areas only. We have to be able to treat in the rural areas also. We cannot treat HIV and manage HIV, educate HIV using only professionals. We have to use non-professional, like the health extension workers who are not professionals.
The strategies the government has been taking in order to realize the vision of universal access to HIV services were, as I said, related to the challenges. So we started from the community-related challenges in terms of community mobilization to increase the awareness, the knowledge, the attitude of the people towards HIV infection, to develop a positive attitude to people living with HIV/AIDS in order to reduce the stigma, so that people can prevent HIV infection, so that people can reduce their risky behavior as far as HIV prevention is concerned, and then to increase the treatment literacy in the community, so that people infected with HIV can easily go to the health facility and get the service.
እንግዲህ አሁን የምንሄደው እናቶች ለእናቶች ድጋፍ ቡድን ውስጥ ክፍል ውስጥ ነው። ብዙ እናቶች አሉ። ተመርምረው ራሳቸውን ካወቁ በኋላ ወደዚህ ክፍል ይላካሉ። አሁን ወደ ምንሄድበትና ወደ ማሳያቸው ክፍል ውስጥ ኑና አይዋቸው በቡና እጥ ፕሮግራም ላይ እንማማራለን። ለማላችሁ እናቶች እነዚህ ይመስላሉ። ያለንን ልምድ እንካፈላለን። እንዴት አድርገን መኖር እንደምንችል እንዴት አድርገን ደግሞ ለሌሎቹ መትረፍ እንደምንችልም ካለ ተመክሯችን እንወያያለን። ተስፋ ልንቆርጥ እንችል ነበር። አሁን ግን እንደምታዩ የሚያማምር ልጆች ይዘዋል።
እና እዚህ ቡና መጠጥ ፕሮግራም በጣም ብዙ ህይወት ይለውጣል እና ፍሬንድ ይሁን ነፃነት እንዲሰማኝ አድርጎኛል። እና እኔ ለቤተሰቦቼ አልነግረውም ነበር። እኔና ባለቤቴ ብቻ ነበር የምናውቀው። ግን እዚህ ላይ በማገኘው ትምህርት የተነሳ ለወንድሜ ለእህቴ ለቤተሰቦች ሁሉ ነገርኳቸው። ስነግራቸው እንደፈራሁት ሳይሆን ያው ማንንም ሰው መኖር እንዳለበት እነሱ ማጽናኑ ምንም አላገለሉኝም። እና እዚህ ቡና መጠጥ ፕሮግራም በጣም ብዙ ህይወት ይለውጣል እና ፍሬንድ
It was an all-inclusive approach, using the church, the leaders of the religious leaders, traditional leaders, leaders of youth clubs, women's organizations. Everybody had to be mobilized.
Ambitious as it was, the decentralization of the comprehensive HIV/AIDS services needed a massive mobilization of human, financial and material resources. PEPFAR and other key donors intervened to help the government change its vision to reality.
USAID is only one of the 5 partners that implement the PEPFAR program. So it's very easy as a donor to insert yourself in a government that has great leadership and has plans of where they're going, and you just work with the other partners and the government to go forward on this roadmap.
Through the President's Emergency Plan for AIDS Relief PEPFAR, USAID has begun to fund HIV/AIDS care and support programs in Ethiopia.
So implementing partners are a way that the US government works with the government of Ethiopia. And so a partner would bring additional skills to complement the government's effort. We've been able through the major care and treatment partners to bring the US expertise into the country to support the implementation of programs here in Ethiopia.
The provision of technical and financial support of PEPFAR through healthcare support programs in the past half-decade has proved to be vital for the success of decentralization and task-shifting of HIV/AIDS services in Ethiopia, thereby benefiting hundreds of thousands of people living with HIV/AIDS.
When PEPFAR came into picture, or came to Ethiopia, they started to align with the strategy of the government. That's a very important startup, I think. Then, following that is support to build the human capacity, support to build the laboratory infrastructure, support to improve the pharmaceutical supply chain management system in the country.
The role of USAID and its partners were instrumental in the execution of the program along the line of Ethiopian government strategic plans, which enabled the most vulnerable access to the services.
We work at the national level, supporting the government with the production of guidelines, of advising on some policy directives, And at the regional levels, we provide support through implementing partners for service provision.
MSH and its partners embarked on a massive training of health workers from selected health centers. Quite a number of mid-level health workers from health centers were selected. They were trained and deployed. Not only that, these health centers were also equipped with basic HMIS materials, books of registration books and so on. To keep adequate information in place, data clerks were recruited, trained and deployed. I'm now talking in terms of the coverage at the end of the program period. This period covered about 350 health centers. It also covers additional 200 health centers, totaling to 550 health centers.
The cooperation between the Ethiopian government and its development partners in reaching out to the most needy for the better access of services has demonstrated a remarkable success to the past 5 years.
There is really a significant improvement, a huge improvement compared to 5 years ago. Number one, in terms of HIV counseling and testing, if I can say, the number of people who were tested 5 years ago were less than 500,000 at national level. Just last year in Ethiopian physical year, 9.4 million people were tested, just in 1 year. So you can see that there was around 20 times improvement from just less than 500,000 in 1 year to 9.4 million just in 1 year, just from HIV counseling and testing services. If you look at also antiretroviral treatment services, in early 2005 there were around 900 patients who were getting free antiretroviral treatment. But now we have around 290,000 people who have been enrolled in HIV care and treatment services.
The generous support of the people of the United States and USAID have been very instrumental. Without the support that was given to MSH, HCSP and the program as a whole, in terms of finance, in terms of technical support, most of it couldn't have been realized.
Thanks to the collaborative efforts of government development partners, HIV/AIDS could no longer be a killer as it was perceived 5 years ago.
Currently, people look HIV as a preventable disease. As a result, they have low stigma and discrimination.
ሰው አቅፎ የሚይዝሽ ከሆነ ሰው ከሁሉም ነገር ካንቺ ጋር የሚኖር ከሆነ እኔ እውነቴን ነው የምልሽ ስንት ነጻ ሰዎች ከኔ ጋር እንደዚህ ተሻምቶ ሲበሉ በቃ ውስጤ በጣም ረካለሁ በቃ ደስ ይለኛል
በጣም የሚያሯር ዱብ እያልኩ መስራት ስለምፈልገው እሱን ፈልግልኝ
Now we're seeing people that are on treatment, they look normal, they feel healthy, they're productive, and they're working. So it gives so much hope to other people that there is a bright light at the end of the tunnel with treatment.
Now Gannet is no longer feeling desperate in her life as she used 2 years ago. She now lives a happy and healthy life. Moreover, she's not lonely. She's married and has been able to give birth to a child who has tasted HIV negative. Gannet believes now that people's attitudes towards HIV positive people has changed a lot. The stigma and discrimination that was prevalent years ago is now reduced.
ከኔ እንጀራ ምናምን ማን ይገዛኛል ምናምን ነበር የምለው ግን ከየትም ትቶ ነው መጥቶ ከኔ ይገዛል አሁን ከኔ ገዝቶ ሁሉንም ነገር ቲማቲሙንም ሽንኩርቱንም ከሰሉንም ከኔ ይገዛሉ በቃ ሲገዙ ውስጤ በጣም ደስ ይለኛል በቃ
We believe we have moved a lot, but we also believe that there needs to be done much more.
In the past 4 and 5 years, a remarkable achievement has made in the making the life of the people living with HIV/AIDS better. Yet, a lot remains to be done.
እርግጠኛ ነኝ እነዚህ እንድሬ ብዬ ሞቶኝ እና አሁን አልሞትም ብዬ ተስፋ ያለኝ ከእግዚአብሔር ጋር እና ልጄ አንድ ነበረች አሁን ሁለት ሆኑልኝ ይበቃኛል